Good morning, Dr. Hanna. How are you?
Good morning, Kyle.
I'm glad we can connect again. And today I'm going to put you on the spot. So I have a
All
question for
right.
you. So, Dr. Hanna, what do you hope will be different in the mental health space after this crisis begins to wind down and calm down?
Wow. What do I hope? Hope is kind of like sometimes, not to get philosophical right off the bat about hope versus wishful thinking. What do I yearn for in the mental health space? Um, I'll tell you, this is, and this is something maybe we've kind of alluded to before, but um, mental health is so focused on pathology all the time.
Hmm.
And what I would hope for is that this situation would help us see beyond the typical mental health conversation of treatment, you know, um, in terms of disorders. I think one of the things that I'm already seeing, everybody keeps talking about how there's going to be all this PTSD, post-traumatic stress disorder, and my gut instinct on that is I feel like it shortchanges what we're going through, right? We're so quick to want to, talk about psychiatric illness and diagnosis and treatment, and there's a place for that, obviously. There will be a lot of people who've gone through a lot of very significant trauma in this. Um, but I just, there's something about that language of just going, oh, the rates of PTSD are going to explode, and we're going to need trauma-based therapy, and again, there's a place for that. I don't want to be dismissive of that, but I would hope that mental health would kind of also recognize the value of understanding that there's more going on here, right? We've had such a radical shift in how we do life, and what is important to us, and that mental health would step back a little bit and see beyond its paradigm of illness,
Hmm.
beyond its paradigm of disease, and the psychological ramifications of loss, and just the psychobabble that we're all prone to being a part of this profession, and kind of look and see big picture about wow, is there something about the way we do life that we're so used to doing life and what we value, our consumerism and our materialism that's kind of being directly challenged, and our hope, putting our hope in our satisfaction and wealth and accumulation and status, and and education, and or in entertainment and pleasure or sports, and for mental health to kind of recognize the role that those types of things play here. And we've talked about this before in numerous videos about the purpose of our life and what gives life meaning, and again, mental health tends to kind of stay away from those things. So my hope is that that becomes part of the conversation, that faith and kind of becomes a bigger part of the mental health conversation, the role faith plays in resiliency, in people being able to withstand and to have courage to do what they do. And how do we cope in the midst of a pandemic where we feel so unmoored, where we have no foundation.
Hmm.
So I kind of, I hope we go beyond psychobabble. I hope we go beyond diagnosis, beyond looking at numbers of how many people now have PTSD and how many people are going to need treatment. That we think big picture.
Yeah.
So those are my thoughts. That's my instinct on that question.
Yeah, it's so good. Thank you. Thank you for sharing that, Dr. Hanna.